Episode 13, Biomarkers of Response. Who might benefit from ribavirin? Welcome to Ribavirin Reminiscence and Lingering Load in Long COVID-19. I'm your host Anushka, a genomics enthusiast who's delved deep into the blueprints of life. Today, we are at the crossroads of precision medicine and virology, asking how can we predict who might benefit from ribavirin in long COVID? With the condition's myriad phenotypes and ribavirin's dual nature of risk and potential, biomarkers could be our guiding stars. Joining us is once again Saakshi, whose expertise in microbiology brings critical insights into microbial dynamics and antiviral strategies. Sakshi, it's wonderful to have you here.
Thank you, Anushka. This is a pivotal and intricate question that I'm eager to explore.
Let's begin with the overarching view. In genomics, we have learned that individual genetic variations can dictate tailored therapies. Similarly, in long COVID's diverse landscape, biomarkers might be essential for personalizing treatment with ribavirin. So, Sakshi, why are biomarkers crucial in this context?
That is because long COVID is not a monolithic condition, rather, it's a spectrum. Some patients may harbor persistent viral antigens, while others grapple with immune dysregulation or autonomic dysfunction. Administering ribavirin universally could lead to unnecessary side effects for many. However, by identifying those most likely to benefit, perhaps through cytokine profiles, PCR positivity, or even antibody patterns, we can target treatment more effectively, optimizing the outcomes and also minimizing the risks.
Let's delve into these biomarkers. Cytokines act as the body's alarm signals, indicating inflammation or immune activity. What insights do cytokine profiles offer in long COVID that could inform ribavirin use?
Numerous studies, such as those reviewed in Biomarkers for COVID 19, indicate that long COVID 19 patients often exhibit elevated pro inflammatory cytokines, such as interleukin 6 or IL 6, TNF alpha, and occasionally type 1 interferon. These molecules are a part of the immune system's response to viral threats. If ribavirin can mitigate low level viral replication, it might help dampen this inflammatory response. Crucially, patients with a cytokine profile suggestive of ongoing viral activity, marked by elevated interferons, might be more responsive to antivirals like ribavirin compared to those with purely autoimmune or post inflammatory patterns, where other therapies might be more appropriate.
Another key marker is PCR testing, which can detect lingering viral RNA. It's akin to searching for footprints long after the intruder has left. Can we use PCR positivity to guide treatment decisions?
Indeed, a subset of long COVID patients continues to test positive for viral RNA in various samples, such as stool, saliva, or even lower respiratory tracts, weeks or even months post infection. While PCR positivity does not necessarily indicate active replication, it may suggest residual virus presence, as noted in studies like targeting SARS-CoV-2 in long COVID. Early research correlates this persistence with symptoms that may be fatigue, GI issues, or even brain fog. Thus, persistently PCR positive individuals could be prime candidates for antiviral interventions, including ribavirin, though confirmatory trials are essential to establish efficacy and safety.
Now, Antibodies serve as the immune system's memory of past encounters. In long COVID, do antibody levels provide clues about ongoing infection or are they merely historical artifacts? How can they help identify potential ribavirin responders?
It's a nuanced picture. Elevated or sustained anti-spike IgG levels might indicate continuous antigen exposure, hinting at viral persistence, as some studies have found higher antibody titers in long COVID-19 patients compared to fully recovered individuals. Conversely, in the immunocompromised individuals, warning antibody levels might signal an inability to clear the virus completely, potentially allowing the reservoirs to persist. Thus, low antibody levels could be a risk factor for persistent infections, while high levels might reflect ongoing immune activation. Deciphering these signals clinically, as discussed in biomarker definitions, remains challenging, requiring further research to clarify their predictive value for ribavirin response.
So, if I were a clinician contemplating ribavirin, what combination of biomarkers would prompt me to consider it? Is there a specific profile that stands out as a potential responder?
I would look for a constellation of indicators here, which may be persistent low level PCR positivity, suggesting residual viral presence. Another is elevated levels of interferons or IL-6, indicating a viral driven inflammatory stage. Another one could be detection of viral antigens in stools or tissues, providing direct evidence of persistence. Also, symptomatology suggestive of viral reservoirs, such as GI predominant issues or even ongoing anosmia, which may point to gut or olfactory tissue involvement. A synergistic assessment of virologic and immune markers, as emphasized in what are biomarkers, would likely offer the best predictive value for identifying ribavirin responders.
Looking forward, are there any clinical trials on the horizon that utilize these biomarkers to select patients for ribavirin treatment? It seems like a natural progression.
While not yet underway, such trials are being conceptualized as indicated by recent NIH initiatives outlined in NIH long COVID research. Some post-viral cohort studies are beginning to stratify patients based on immune signatures or tissue-specific PCR results. The ideal future trials would employ pre-treatment stratification, enrolling only those with biological evidence of viral persistence in order to evaluate ribavirin's efficacy accurately. This approach would transition us from a generalized treatment model to precision therapeutics tailored for long COVID, aligning with the principles of biomarker driven research.
Saakshi, thank you for shedding light on this complex topic. It's evident that biomarkers could serve as our compass guiding us through the murky waters of long COVID treatment decisions, particularly with a drug like ribavirin.
Absolutely, Anushka. By identifying the right patients at the right time, we can definitely transform ribavirin from a contentious choice into a precise tool in our therapeutic arsenal.
Next time on ribavirin reminiscence and lingering load in long COVID 19, we'll examine the risks of resistance. Has SARS-CoV-2 exhibited adaptability to ribavirin? And what lessons can we draw from other viruses? Until then, I'm Anushka. Thank you for tuning in and remember to stay evidence based.